Hi, I'm Dr. Reshma and I'm a consultant radiation oncologist at Medicover Cancer Institute, and I'm here to talk about cervical cancer. So cervical cancer is one of the most common cancer in the world, and it is especially common among Indian females. The cervical cancer originates from cervix, which is the lowermost part of the uterus. This is generally seen in elderly women or middle-aged women. The most common cause of cervical cancer is HPV, which is human papilloma virus. Once you get infected with HPV virus, it takes about 10 to 30 years for the cancer to develop. And these early times, the patient might not say any signs and symptoms. So screening is very vital in this cervical cancer. Screening tests are actually done periodically in healthy, fit women who do not show any signs or symptoms to catch the cancer at an earlier stage. For cervical cancer, the screening includes pap smear, which is done every 3 years, or you can get a pap smear with HPV DNA testing, which can be done every 5 years. The testing or the screening for cervical cancer starts from 21 years of age or once the girl is sexually active, and it should be continued till 65 years of age. Also, cervical cancer is one of the cancers which is preventable. Because HPV is the leading cause of cervical cancer, we can prevent the cervical cancer or HPV related cancers by giving vaccine against the HPV. This vaccine is generally given at an age of 9 to 10 and can be given in both women and males. And this might prevent us from future cervical cancer or benign cancers. So now you know the screening and the prevention of cervical cancer. You should also be aware of signs and symptoms of cervical cancer. So the most common presenting sign of cervical cancer is actually bleeding per vagina. So this bleeding per vagina in a case of postmenopausal women is very important because any bleeding in a postmenopausal woman should be evaluated. In case of a premenopausal woman, if the vaginal bleeding is not in sync with your menstrual cycle, it should definitely be evaluated. Also, the second most common sign of cervical cancer is white discharge. This white discharge, unlike your regular white discharge, is generally foul smelling. It can be continuous from weeks to months, and it can be associated with the bloody discharge. Once the cervical cancer grows and advances, you might notice more symptoms like lower abdominal pain, lower back pain. You may also feel urinary or bowel complaints and also swelling of the limbs. Now that you are aware of cervical cancer, its signs and symptoms and its prevention strategies, you should spread this awareness to your friends and family and be vigilant when to approach your doctor and get yourself screened.